So, good day sir. My name is Dan Rasilim Coliado and I am your student nurse from Pamantasan ng Lungsod ng Marikina. And I will be doing an interview with you today. Are you Mr. Noel Pajardo?
Yes.
Okay sir. The purpose of this interview is just to gather your medical history and rest assured that the information you've shared to us will remain confidential and just between us and other medical healthcare providers only. So just to be sure, sir, is it really okay with you to participate in this interview?
Yes, of course. It's fine.
So now I'm going to check your personal information. What is your name again, sir?
My name is Noel Fajardo.
And how old are you?
I'm 27 years old.
When's your birthday?
My birthday is October 4, 1994.
So, sir, where do you live?
My address is Block 39, Barangay Tumana.
So, Sir Noel, are you single, married, or in a relationship?
Yes, I'm single.
Okay, so now, sir, we'll proceed to the history-taking interview. Is it okay with you, sir?
Yes.
So, Mr. Pajardo, what's your reason for seeking healthcare today?
The reason I'm here is I experienced chest pain these past few days.
So, when does the chest pain started?
It started around January, I think 3 days after the New Year's Day.
Okay, so it's been going on from some time now?
Yes.
Okay, so sir, is it okay with you to point the exact area where it hurts? Okay, on the sternum. So sir, does it hurt anywhere else?
No, just in the middle.
Okay, just in the middle. So can you explain to me, sir, how does the pain feel? Does it feels like tightening? Does it sharp? Does it have a burning sensation?
It feels like there's a burning sensation and there's a sharp feeling in my chest.
So, sir, does the pain last or does it comes and go?
It comes and go.
Okay, sir. If you can rate the chest pain from 1 to 10, 10 being the most painful and 1 being the least painful, what number would you give me, sir?
It feels like it's 8 because sometimes the pain is bearable but sometimes it's worse.
It comes and goes. So, sir, if the chest pain come, how long does the chest pain last?
Varies. Sometimes the pain lasts long for 10 minutes. Sometimes the pain took longer than like 30 minutes.
Okay, Sir Noel. May I ask you if what do you think are the things that trigger the chest pains?
I don't know what triggers it because it happens at a random time.
Okay, so Sir Noel, what do you do to lessen the chest pain then? Do you drink medicine for it? Do you just like rest and sleep the pain away?
I just sleep and ignore the pain.
Okay, you just sleep and ignore the pain. So other than the chest pain, sir, do you feel any other discomfort? Do you have any health concerns?
No, the chest pain are the one bothering me.
Okay, Sir Noel, in the past, do you recall having any illnesses like chickenpox, asthma, measles?
No, I haven't had any of that.
Okay, you haven't. So, are you allergic to anything since you were a child?
I'm not.
Okay, sir, have you ever been hospitalized?
I have not.
Okay, so have you ever had injury or accident that needed medical care?
No.
Okay, so have you ever been hospitalized then?
No.
What about blood transfusion? Do you participate in any of that?
Not yet.
Yeah. So, did you take any immunization when you were a child?
Yes.
Okay, so how about now? Are your immunization updated up to this day, sir?
Yes.
Okay, good. So, Sir Noel, over the past few weeks, how is your mental health? Do you feel any sense of feeling down, depressed, or bothered by something?
Yes. I was bothered and stressed about my health condition.
So now, Mr. Pajardo, I am going to ask you about your family's health history. Is it okay with you, sir?
Yes.
Okay, so, sir, do any medical conditions run in your family? Has anyone in your family have high blood pressure, asthma, heart disease, or any mental disorder?
No.
Okay, sir, now I am going to ask you about your personal background. Are you comfortable with that?
Of course.
Great, so how do you feel about yourself today, sir?
I feel fine. I don't feel any chest pains right now, so I'm fine.
Sir Noel, what languages do you speak?
Tagalog and English.
Okay, so who do you live with?
I am currently living with my parents.
Okay, so do you work or are you only a student?
I am a student.
Okay, sir, what are your daily activities? Do you exercise? Or is there any leisure activity that you do?
My daily activities are studying, eating, and watching television. I exercise sometimes and play sports whenever I want to.
So, how do you sleep? Do you sleep early or late?
I sleep late sometimes.
Why do you have trouble sleeping?
I find it hard to sleep sometimes.
Okay, so do you nap during the day then?
No, I don't. I wake up late actually.
Okay, so what type of food do you usually eat, sir?
I eat whatever on our table. Sometimes there's a meat, sometimes there's a vegetables.
So what about other beverages like beer, wine, or any other alcohol?
I drink sometimes when there's an occasion.
Okay, so do you smoke?
No, I don't.
Okay, so do you use any recreational drugs?
No, I don't.
Are you sexually active?
No,
Okay, so do you socialize? In your school, are you a member of certain organization?
I socialize and I am a member of a club.
Okay, so in your house, does it have a restroom?
Yes,
Okay, so does your house have a proper water supplies? Do you have access to clean water, sir?
we have enough water supplies. Our drinking water is purified and we use water from the faucet for bathing and washing the dishes.
Okay, so what about electricity, sir?
Yes, we have.
Okay, so do you feel safe in your neighborhood, sir?
Yes.
Okay, so what's your weight, sir? Okay.
68 kilo.
Do you have any skin problems like rashes?
None.
Okay, so what about your hair? Do you have any lice or dandruff or hair loss?
None.
What about your nails?
None.
Okay, so what about your head and neck? Do you experience headache, stiffness, or sore throat?
I experience headache sometimes.
Okay, so what about your ears? Do you have problem with it? Like ringing, difficulty of hearing, exposure to loud noises?
None.
Okay, so what about your eyes? Do you have problem with it? Do you have impaired vision and double? Does it have redness or black spots?
None.
Okay, so what about your mouth, nose, and sinuses? Do you experience mouth pain? Okay, do you cough and sneeze? Does your nose bleed?
I don't.
Okay, so what about your chest and lungs? Aside from the chest pain, sir, do you experience difficulty of breathing? Do you have any respiratory infections?
I find it hard to breathe sometimes.
Oh, Sir Noel, aside from all of those, do you feel any discomfort?
None.
So, okay, sir, overall, you came here today because of your concern about the chest pain that you've been experiencing since the first week of January. So, according to Mr. Noel Fajardo, the chest pains happen in the middle of the chest, specifically in the sternum, and the chest pains have a burning sensations, and it gives a sharp feeling. The longevity of the pain varies. Sometimes it lasts for 10 minutes, sometimes it's 30 minutes. This is the only discomfort that you've been feeling. So, Mr. Noel Fajardo, we would have to identify your health concern through nursing diagnosis and also with the help of other medical provider like the doctor. It is also required to run some tests to you in order to further confirm your medical condition to make sure. So that's it. Do you have any questions?
None.
Okay, sir. Thank you.